Okay, well, people are still signing on here, but I think we should go ahead and at least get the preliminary started here so that we can keep on time. And there's so much interesting to talk about today that I would rather start a little early and leave a little more time for the conversation. So welcome everyone. This is our third Think and Do event of the semester. The first one, the first Think and Do was on voter access and voting rights and voter suppression. Second one was on affordable housing. And then today we'll be talking about Medicaid expansion in Texas. So it's we've had a great semester of events. My name is Dan Inkster. I'm the director of the Elizabeth D. Rockwell Center on Ethics and Leadership at the Hobby School of Affairs. We're a co-sponsor of this event. Our other co-sponsor is the Center for Civic and Public Policy Improvement. There've really been four of us this semester who've been organizing these events. It's me and Graham Lee from the Elizabeth D. Rockwell Center at the Hobby School, and Sean Haley and Jordan Everett from CCPPI. So I'm going to hand things over now to Sean to say a few words about CCPPI and our partnership and the idea behind these Think and Do lunches, and then we'll get things started.
Thanks, Dan. We are super excited about this particular activity today and the conversation today. But really, this has just been such a fantastic opportunity for the Center for Civic and Public Policy Improvement to partner with the Elizabeth D. Rockwell Center on Ethics and Leadership at the Hobby School of Public Affairs, because our partnership, we just love this opportunity to really elevate what we're dedicated to at CCPPI, which is promoting policies and actions that promote both human, civic, social, and economic justice. So all those things are where our foci lie. And that's where this partnership with the Hobby School has become really strong. And Dan, we thank you so much as director and for your leadership there and taking the time to work with CCPPI to help us elevate those things that we're really truly concerned about. And it's not coincidental, obviously, that we're working together, because these things are all very important for both the work that you're doing and the work that we're doing. So just wanted to take a moment to say thank you to you as director, as well as obviously thank you to Dean Kurt Watson for supporting these efforts. And finally, just want to give a special welcome before I pass it back to Dan to another one of our partners, a leader for an organization that we work with and have partnered with at the Children's Defense Fund, Dr. Laura Guerra-Cardus. We're so happy to have you. And so I'll pass it back to Dan with that, and thank you guys for joining us.
Mm-hmm. All right. Well, thank you, Sean. Yeah, it's great. It's great to work with CCPPI. We're going to continue to work, at the Hobby School. We're going to continue. We want to keep working with you guys. And in addition to, just having all kinds of opportunities to do great things, just really enjoy working with you all. You're really, really interesting, good people to work with. So thank you for that. Okay, so let me just say a few words about the format. We're going to go about 20 minutes of discussion. I'll be asking some questions of Dr. Guerra-Cardus. She'll be responding. We will then have breakout rooms where we'll have a do activity, which is one of the features of these events. We try to get you to think about things and then think about doing things relating to these issues. We'll be in the breakout rooms for about 8 to 10 minutes. We'll come back and you'll have a chance to make comments or ask questions, including questions about more information you might need in order to really decide how you feel about this issue, or what you think should be done, or what you might do next about it. So, so as this conversation is going on, as we're in the breakout rooms, be thinking of questions. At any point, you can go ahead and write your questions into the chat. We'll get to those towards the end of the, after you come out of the breakout rooms. But the chat, if you're not familiar with Zoom, it's at the bottom of the screen, right in the center. You just click on it, a little box will open. You can type your question or comment in there. For the first part of the conversation, I'll ask you to mute your microphones if you haven't already. If you want to have a big picture of the speaker, you can go to the upper right-hand corner to the view. If you click on view, and then you'll see a little drop-down menu and go to speaker view, then that whoever's speaking, you'll get a big picture of them. So that's your option. Okay, well now let me introduce our speaker today. I'm very excited that she's with us, Dr. Laura Guerra-Cardus, Deputy Director of the Texas Office of the Children's Defense Fund. Dr. Guerra-Cardus is a graduate of Rice University and Baylor College of Medicine in Houston, and currently leads the Children's Defense Fund's policy initiatives, including the Sick of It Texas grassroots campaign for healthcare coverage. Additionally, she's a leading member of the Cover Texas Now and Children's Healthcare Coverage Coalitions, which work to ensure that all Texas children have access to affordable, comprehensive healthcare coverage. She's wildly knowledgeable about these issues, and somebody who's been who's really in the thick of working on these issues. So really, it's great to have her here today. Thank you for being here. And I'm very excited for this discussion because I'm sure I will learn a lot. Dr. Guerra-Cardus, if we could just start, really basically, could you say what is Medicaid and how does it work?
Sure. And just so everybody knows, as we go through these questions, I know we only have 15, 20 minutes at most to get through a lot. So I pulled out kind of the most important pieces for each of these. I know there's several other experts that I admire in the audience here, so I just want to recognize that. In short, in Texas, because it varies state to state, but in Texas, Medicaid is a health insurance program for low-income vulnerable populations, and that is primarily children. 75% of the population on Medicaid are children. The other vulnerable populations that Medicaid covers in Texas are Texans with disabilities, pregnant mothers, and low-income seniors, typically in nursing homes. I emphasize the children's piece because a lot of people don't know that Medicaid is the primary insurance program for children. It covers about 1 in every 3 children in Texas. And just so that we understand the scale of the population covered by Texas Medicaid, roughly 3 million are children versus about 150-ish pregnant women, 150, I'll get to this, the few adults that Medicaid covers. But the numbers for seniors are in the 400,000 range, and Texans with disabilities, 400,000. So we're talking about hundreds of thousands for the other vulnerable populations, but 3 million children are covered. And a lot of people really don't think about Medicaid as the children's health coverage program. The mention I had for a sliver of adults that Medicaid covers in Texas, we're talking in the range of around 150,000. And the eligibility is pretty strict. You must be a parent. You can't be a childless adult. And you have to make about 19% of the federal poverty level. So for a family of 3, a mom with 2 kids, you have to make less than $320 a month. So we almost have no health insurance for low-income adults in Texas. Now, Medicaid means something different in other states, particularly those that have expanded Medicaid to cover those low-wage workers. In a state like Texas, we're one of only 12 that have yet to expand Medicaid. We do not have an affordable coverage option for low-wage workers who do not get health insurance through their employers.
All right, well, good. So you just mentioned Medicaid expansion, and again, staying fairly basic just to get everyone into the conversation. I'm guessing most people have heard of Medicaid expansion, but could you explain what that is and why it's an issue in Texas, as well as you mentioned, there are 12 other states. I think they're mostly southern states, right? Who haven't expanded. Yeah, can you talk about that? What Medicaid expansion is and what the issue
Sure.
is?
So the Affordable Care Act, in an attempt to provide all Americans better access to healthcare coverage, included a piece of it to create what's called Medicaid expansion for states. So the ability to allow states to expand beyond just vulnerable populations and allow Medicaid to be the program that can deliver affordable health insurance to low wage adults. Now, when the Supreme Court ruled on the Affordable Care Act many years ago, that was the one piece that they found that they altered. They said that it needed to be a state choice of whether to do that piece of the ACA or not. Over the years, we now have 38 states plus the District of Columbia that have chosen to expand Medicaid. The benefits to the state and to the citizens of a state are really overwhelming, and that's why we've seen the majority of states, but there are 12 remaining states that have yet to expand Medicaid, and 8 of those 12 are in the South. Now, why does Medicaid expansion matter so much to Texas? We have the highest rate and number of uninsured people in the nation, and we have had that distinction for over a decade, since I've started working here, almost 15 years ago. Now, we have also the highest uninsured rate for various categories. 1 in 3 non-elderly adults in Texas lack coverage, 1 in 4 women of childbearing age lack coverage, and more than 1 in 10 children in Texas lack coverage. And we are usually head and shoulders above the next state down. And so that causes a lot of problems in our state. Our inability to really tackle maternal mortality and morbidity, ensure access to mental health care and substance use disease or substance use disorder treatment. We have a lot of young children who aren't getting access to healthcare. We have the highest rate of rural hospital closures in the country, again, by far. And we really miss out on our ability to maximize Texas taxpayer dollars because we do not recoup the federal tax dollars that we're paying out, but we're having to absorb 100% of the cost of caring for uninsured populations at the local level. So it's really one of the biggest handicaps that we give ourselves here in Texas in terms of, just so many areas, including just our abilities to support families' health and economic security, which of course is even more important now that we're dealing with the healthcare crisis and the economic crisis that comes with that.
So we have a good number of states that have passed Medicaid expansion, or accepted the Medicaid expansion. Still almost a fifth that haven't, a fourth. So we should have some kind of sense of what it does when a state expands Medicaid. And can you talk about that a little bit?
Yeah,
Evidence we have?
and I did pull that out. That's a great thing kind of about this moment in time is we don't have to guess anymore the impact of Medicaid expansion on states. Early on, people said, well, it's going to break the budget. Well, it won't really cover that many people, or it won't impact health outcomes. And all of that has been proven to not be so. There are now hundreds of studies that show that Medicaid expansion states have reduced their uninsured rate, have significantly reduced uncompensated care costs. So those are the costs that counties and local communities, have to cover when we leave people uninsured. the data shows that there is significant increased access to care. There's a better ability to control chronic illnesses like diabetes and hypertension. It decreases depression and has many benefits on the mental health front. It decreases premature deaths. There's actually a count of the number of individuals that were lost because of the lack of access to care. Catching early stage cancer diagnosis, the list goes on. On the economic side, it also is showing an increased financial stability and economic mobility for individuals. And at the state level, not only has it not broken the budget of any state that has done it, nor is any state that has done it wanting to undo it because of, for any reason, but including budget issues. But many states have shown that it has been a net positive impact on their budget. And in fact, in Texas, we've had studies after studies also showing this. And the most recent one came out this year, funded by the Episcopal Health Foundation, that really details why doing Medicaid expansion in Texas would have a net positive impact on our budget. There's a lot of piecemeal healthcare programs that we pay for with 100% state dollars that would not be needed if we just provided healthcare coverage to this population. And there's some other reasons as well, but we can't afford it. Just really needs to be taken off the table as a reason why states should not do Medicaid expansion.
Okay, that's great. So let me put on the devil's advocate's hat here for a moment, because it almost sounds too good to be true, right? You're telling us that we can improve the health of Texans, expand, health access to health coverage, reduce costs. We can especially address the needs of children, which is a population that usually, especially people are sympathetic towards. So why aren't we doing it? What are the reasons that are holding us back?
Yes, it's hard. It really is hard to find any reason of why we wouldn't want to extend coverage to 1 to 2. It's estimated at 2.2 million Texans would have access to coverage if we did Medicaid expansion. It's expected that about 1 million would enroll early on. Of why we wouldn't do that for our population if it cost us nothing and it had all these other benefits. I guess the short answer is that it really has been less of a policy discussion and more of it has been made into a political issue. And the problem with political issues is they're not based necessarily in the data or rationale that we would look towards as people wanting to improve healthcare, but more about ideology and party affiliation. Now, I think this is where the recognition that 8 out of 12 state non-expansion states are in the South comes into play. The South has the legacy of slavery and more extreme racial disparities just lives on and lives more strongly in the South. I'm trying to think which data point to say first here. 92% of adults in the coverage gap in the nation are in the South. So the people that are being left out are predominantly in the South. 1/3 of those are in Texas. And in Texas, 74% of those that would benefit from Medicaid are people of color. So our state and others in the South are making policy decisions that are reinforcing structural inequities. And if we want to do something about that, doing Medicaid expansion or another similar coverage expansion policy program is absolutely required. And people can kind of guess for themselves, but I think It's at the end of the day, it's our history of being willing to accept unequal access for different populations here in Texas that has kept us from taking action on this issue.
I wonder, as you were talking, also, is there any role of, I guess recent immigrants are eligible, right? For Medicaid, no?
No, if you are, if you are for Medicaid, if you are not a citizen generally for this Medicaid expansion population, you would not qualify. There are some legal immigrants that would qualify for the marketplace coverage. But when we're talking about Medicaid, nobody should confuse that with healthcare for individuals who are not documented. Yeah.
Okay, good. So can you talk a little bit about your work with Syncopated Texas and what you're doing to try to promote Medicaid expansion?
So Syncopated Texas is a grassroots campaign for improved healthcare coverage in Texas, and the reason we committed to trying to create, build, and grow a grassroots campaign is that very recognition that we're not dealing with a policy problem, we're dealing with a politics problem. And so when that's happening, you need to utilize and build different tools. You know, the right fact sheet, the right policy compromise, we think is really not going to get there, but it's more about fertilizing the landscape so that coverage issues can start growing. And we really saw, the problem with just the overall landscape here in Texas during the last legislative session, when not only was there no traction to really seriously talk about Medicaid expansion, but maternal health coverage was not addressed, despite that being a bipartisan issue and widely supported and kind of a critical step in addressing our maternal mortality rate. But even children's health coverage was not addressed. And there's an issue with the Medicaid eligibility for children that's kicking about 50,000 eligible kids off of their healthcare coverage in the middle of the year. That has nothing to do with the Affordable Care Act, and we could have taken action to fix it, to partially fix it, even at no cost. So when policies beyond Medicaid expansion that have to do with coverage that would cost us nothing sometimes to do are not getting traction, we have a big problem. And our audience needs to switch from policymakers to their constituents and the public. So that's who we consider the Syncopated Texas audience to be. It's educating Texans about all these issues and engaging them to work with us to communicate a strong message to policymakers that we expect them to take action to expand coverage for Texans. And we really welcome everybody kind of joining us and following us. We've been able to generate kind of more direct actions, so messages to the governor and to other policymakers in the last year than we have in a while. And I think this is really going to take raising that public voice and the public demand. And that's not a partisan issue. Poll after poll has shown that Texans on both sides of the aisle support improving coverage. They want the legislature to do something about it. And we even have majority support when you even use the phrase and the exact policy of Medicaid expansion. So we're focused on engaging more Texans kind of all stripes to start communicating that to policymakers in a more effective way.
And has the pandemic affected this? Is this? Have you sensed an acceleration of support for this kind of?
Oh yeah. I think the pandemic has really rushed support for the need for Medicaid expansion. So we've noticed a few differences in the landscape. One is a lot of groups have come out since the pandemic hit to publicly ask the governor to, he can do it with direct, executive action to do Medicaid expansion. This is the provider groups, letter with over 30 sign-ons from the Texas Medical Association. The Cover Texas Now members did a letter with 57 groups signing on, and this is, from the Texas Hospital Association to the rural hospitals to faith leaders. It's really just kind of everyone across the board, and even groups that had previously been cautious to come out on Medicaid expansion because it had become a political issue here. The one that comes to mind for me is AARP Texas, came out with a public kind of letter, press release directly at the governor saying that we need to do Medicaid expansion. So that's a big shift and really puts us, unfortunately, this horrible situation we have with the pandemic, I would say put us kind of a year ahead in kind of building up, re-engaging those kinds of partners in supporting Medicaid expansion. The other is that for the first time, we saw candidates on both sides of the aisle talking about the need for Medicaid expansion during this election season. So that is a really significant change. And so I think, while it is absolutely no guarantee, Medicaid, we're still in a difficult political climate here, but Medicaid expansion is or coverage expansion is on the table this session more than I think most people would have ever thought it would be. But to get it kind of across the finish line in the next 2 to 4 years, it's really going to take engagement and activism from, as many people as we can possibly get on board.
Well, great. So on that note, let's send people into the breakout room, the do session. Jordan, could you post the questions for us? Is that how you usually do it? Post them in the chat room?
Yes, I'm going to post. So if y'all could open that before you got into your rooms, there's 3 questions there. And then there's also some stuff that we collaborated with Dr. Guerra-Cardus to put some calls to action that if you click on those links as well. So you can check that out.
So I'm going to send you all into, including you, Dr. Guerra-Cardus, you're going to be sent into a room. You can jump out if you want or stay in it. I'll send you into rooms to discuss these questions for about 9 minutes. Then we'll come back. I see some of you have already posted questions in the chat. Keep those coming. When you're in your rooms, think of other questions, and we'll start hitting those questions when we come back out of this. So I'm going to create these rooms now, and oh boy, I should like to create. I'm going to add a room. Okay. And you should get a message now, an opportunity to enter a room. And so go ahead and click on that, go into your room, and then we'll see everyone back here in 9 minutes or so. Oh, they didn't get assigned.
Background is.
Oh, hey, I just wanted to make sure that I couldn't tell if anyone was in here, so I just wanted to pop in.
I did.
You're on mute, Daniel.
I'm sorry. I was saying all brilliant things too. I was, you missed it. I'm welcoming you all back. I was saying, I hope you had enough time to think about these issues. If you have questions, if things came up in your rooms, your breakout rooms, things that you thought like, well, I don't really know how to answer that. I need more information. Please go ahead, put them in the chat room. I want to go ahead and start working through these questions. There are a couple of interesting questions that were already posted before you went into the room. So keep posting and we'll get to as many of these as we can. Dr. Guerra-Cardus, you're on mute. So I'm about to ask you first question. If you look in the chat, there's an interesting kind of stream that was going in the first part of the conversation. It says, I've heard from more conservative Republican folks that they are worried about how to pay the 10% part of the 90-10% federal state match in the long term. Definitely could be a cover for the willingness to accept unequal coverage. And then someone says, can we just say out loud that non-expansion of Medicaid is a racist policy, definitely discriminatory. So I think there are two questions in that line. One is has to do with the 10% that states will be asked to pay, and if that's really a concern. And then the second one is the role of race in Medicaid expansion.
Yeah, and I know former Chairman Pitts is here with us, and him and his son have really been working on getting that data about the impact of the state budget from Medicaid expansion. On the resource list that y'all will get at the end, I have their paper funded by the Episcopal Health Foundation kind of at the top of it that really goes into detail how it all works. But essentially, a 90-10 match is so enormous that the part of the reason is that the economic stimulus that comes with funneling that amount of money into the Texas economy has a positive economic impact. But also the other thing that I mentioned, that we currently spend significant state dollars on healthcare to incarcerated populations and specialty programs like the breast cervical cancer program that would no longer be needed if we just had a coverage option, kind of for Texans at every income level. I'll just throw in also that because of the pandemic, so many Texans are losing their employer-based healthcare coverage and are in difficult financial strains, that we're having hundreds of thousands of additional Texans really learn and really feel the problem with not having an affordable coverage option for people at every income level. And that's going to be a shock, and we hope also a driver to getting things passed. There was a business man we worked with who said you would never find a business person who wouldn't buy $1 for a dime. And that's essentially the offer that's being made here. But for those that really want to get into this, I encourage you to read that recent report from funded by the Episcopal Health Foundation that just goes into the detail. And the bottom line is it's a net positive to our state budget. It won't only not cost us anything, we're going to make some money from doing it.
Okay, so there's another question, and if again, if you have comments coming out of your groups, I can open it up to that in a second too. But there's mention of a Texas solution. I've heard Texas lawmakers talk about a Texas solution that they prefer over Medicaid expansion. Could you say something about that?
So I forget the year now, but the first year I think that we had the opportunity to pass Medicaid expansion in Texas, Chairman Zerwas proposed a bill called the Texas Solution that attempted to kind of make a middle ground that that would be kind of a good policy and comfortable landing place for more conservative members. Over the sessions, there have been different attempts. So that one was just for that session. It was called the Texas Solution. There's been other kind of policy proposals named, that unfortunately have not been successful to you know, cross the finish line. And that's why that's why we landed on what we need to do is kind of fertilize the ground and so that these ideas can grow. And I think we're getting to, you know, we're at an interesting moment for next session because one, we've been working on kind of fertilizing the ground and work will continue on that. There are groups, because of the support for the need to do something, there are groups that are kind of thinking through like what would be a viable policy to get passed in Texas. And then you have the pressure of the pandemic. We hope that racial and ethnic inequities and justice is a factor here as well. I think we all need to make it a factor. But then we also have that the 1115 Medicaid transformation waiver is ending, and all the simple way I think to think about that is we got some Band-Aid money about 7 years ago to keep our healthcare system kind of afloat and intact. Originally, while we were waiting to do Medicaid expansion, then because we didn't do Medicaid expansion, and that funding is going to end in 2021. If we do not do Medicaid expansion, we will not have the funding to replace the loss of that Band-Aid. And that is going to be just that's just going to spell enormous trouble for our healthcare system. And it'll, you know, if that isn't addressed this session, I do think it's something policymakers will have to answer for in the 2022 elections.